Hi. Where do you want me to go?
We're here in the Alberta Legislature in the Premier's office to chat with Premier Danielle Smith about the year that's just been and what we might see coming up. Thanks so much for joining us today.
My pleasure.
There are potentially some big changes coming south of the border with President-elect Donald Trump coming into the White House. And while he was threatening to put tariffs on Canada, your response might have surprised some Canadians, I think, with saying, yeah, actually, I agree with him. I agree with some of the concerns that he has about the Canadian-US border, drugs, it being a porous location for that. I want you to peel back the curtain a little bit and tell me why you think that response was a good strategy for Alberta.
The issue we face in Western Canada is clearly the drug overdose problem, and it's gotten even more acute post-COVID. We've seen it in British Columbia and Alberta, which seems to have a bit of an integrated drug market, and whether the product is coming in from British Columbia and then finding its way down into the United States through Alberta, or precursors are coming into Alberta and then finding their way back into the United States. We have identified this problem years ago. And so Mike Ellis, my public safety minister, had already begun the process of training up a team of sheriffs that could be deployed for border patrol and dedicated to addressing the fentanyl issue. And so it just seemed like, yep, this is a problem that's a problem for us. It's a problem for the Americans. Let's solve it.
And you frequently have expressed your frustration by what you see from the federal government and the perception of them imposing on Alberta's jurisdiction. Yeah. Some people looked at the messaging from Trump and said, well, are we going to let him as president boss other leaders of other jurisdictions around, right? So what are you doing to protect Alberta's interests from foreign governments?
I'm glad that the federal government is now beginning to see that there are consequences to the policies that they've taken. And now they have to align with the things that we want to do in order to be able to address them and to preserve our trade relationship, which is the most important trade relationship probably on the planet. What I think we can do in Alberta is talk to the Americans about how we jointly benefit from our cross-border trade. Alberta in particular, we provide about 4.3 million barrels a day into the US market, which has a huge impact on their ability to provide affordable energy for their citizens. I think that we can use energy as a point of leverage to say, because of this strong relationship, all Canadian goods should be tariff-free. But I think that leading with the energy file is the way to get there.
I want to turn to education. This government is making really unprecedented investments in charter schools, not just expanding the number that are allowed to be formed, but also helping them build more buildings, right? Expand their footprint. There used to be a limit of 15 charters in Alberta. That cap was lifted by your predecessor. Now there's 22 charters with 38 schools. What is your vision for charter schools in Alberta?
We've seen in the past, unfortunately, that sometimes the public schools, they have low utilization, but they're not prepared to give a school up for an alternative use. And so with that being the case, we felt that we should be able to provide an avenue for some of these new schools to be able to get started. We began with the Charter Hub, which is a way for schools to get started and incubate until they can get to a point where they can go out and find their own school sites. But I would say that the charter school approach has been very successful when they can choose a type of educational format that really works. The public schools are able to adopt it, and that's exactly the kind of innovative model that we want.
Healthcare, it had to be on the list, right? It touches every Albertan. You're restructuring Alberta Health Services with this goal of improving care. Yeah. This idea of restructuring by function, where did that come from? Is it from you? Is it from a consultant? Is it somebody else?
It came from looking into the system and trying to figure out what is the core business that Alberta Health Services is supposed to be delivering. And the answer was everything. And if everything's your core business, then it's really hard to get a focus.
But does anywhere do it by function? Does any other jurisdiction, divide it up in that way? And I just wonder what they've achieved by doing that.
I think a lot of the hospitals have become they really are the only door that people can enter into our system. So let me tell you how we're envisioning the system. We're going to have primary care be one door. We want everybody to have a family doctor or nurse practitioner. The next door that you go through is if you've got mental health or addiction issues. That's a very specialized type of care that you need. And some of it will be inpatient and some of it will be outpatient. But you need to have dedicated individuals who are trained in that area to provide those services. Then you also need to know that if somebody needs long-term care, that with assisted living, that's a totally different function that can mostly take place in a community. If Alberta Health Services manages everything, all of that comes into the hospital. And so you have people who have very complex needs, seniors with mental health issues, maybe even addiction issues, and this is the most expensive bed that they're in. It's a $2,500 a day bed.
What surprises do you have for us in 2025?
So many.
Tell me.
It's not really much of a surprise. I mean, if you look at my mandate letters to my ministers, now mandate letters for a time were not made public, and I just felt like if people want to know where we're going, we should tell them pretty clearly. So if you can see through that there are certain issues that emerge and we have to deal with them at the time. But my ministers are slowly but surely making their way through. I shouldn't say slowly but surely, quickly and surely making their way through their mandate letters. So we do have a lot more to come in the new year. The main thing, of course, is in February, our budget comes down on the last Thursday, and a lot of the framework for what we're going to be supporting will be revealed in that budget document. There's still some final decisions that need to be made through Treasury Board and going through that process, but that launches us into a new legislative session.
Thanks so much for taking the time to speak with us today.
You bet, my pleasure.